Good morning, everyone. I think we might kick off. This is the sixth webinar for the Carer Knowledge Exchange, and today we're going to be focusing on rethinking carer empowerment and resilience, which is very exciting. Just to note at the start that this session is being recorded, and that we ask that while our presenters are speaking today, that all other attendees please keep their microphones on mute and turn off your videos so that we can have opportunities later for everybody to see each other and join in the conversation. My name's Elena Katrakis. I'm the CEO at Carers New South Wales, and it gives me great pleasure to welcome everybody to the webinar today. I'd like to start off by acknowledging the traditional owners of the land on which we meet today. For me, here in North Sydney, it's the Gadigal people of the Eora Nation, and I pay my respects to elders past, present, and also to acknowledge the lands from where everybody else is coming from today, because we've got quite a mix and spread of people across the state, which is fantastic, but also across the Sydney region. So acknowledging the traditional owners there as well, but also importantly thinking and acknowledging Aboriginal carers and particularly the resilience of Aboriginal carers as we talk about that topic today. So for those of you that have joined us before, you'll have heard this previously, but the Carer Knowledge Exchange is a partnership project. It's delivered by Carers New South Wales in partnership with the Institute for Public Policy and Governance at UTS, and it's funded by the New South Wales Government. It's a really important project. We're into our second year now, and the exchange brings together carers, researchers, students, decision makers, professionals, and service providers to really share knowledge about carers, learn from each other, with the aim of really improving outcomes for carers, not only in New South Wales, but across the country, and really that important role of connecting research to practice, because research is one thing, but connecting it to practice enables change. As we said, the exchange, the Carer Knowledge Exchange, delivers 3 webinars every year, and it usually focuses around a priority area of the New South Wales Carers strategy. So today's webinar is the first in our new theme for the next 12 months, which is that carers will be recognised, respected and empowered. And it's pretty timely to be focusing on this theme, given that there's a federal inquiry into carer recognition. And if you're not already aware of the inquiry, I'd encourage everybody in the next couple of days, because it closes on Friday, it's been extended to Friday, to maybe share some of your knowledge and evidence and experience as part of that. We'll be putting a link up onto where the inquiry is, and we'll put that in the chat so that people could link through that. But it's really important that there is this focus on carers at the federal level. So moving back to today's webinar, we're going to start by hearing the perspectives of 4 different guest speakers, offering their lived experience, policy and research perspectives on this topic. And following this presentation, if we have time, we'll have a short break, and then we'll reconvene for a series of facilitated breakout sessions for the final hour of our session today. So we've got key speakers, and we've also got a fabulous person who's going to be chairing the session for us now. So I'm going to hand over to Karen Martin. Karen's a member of the Carer Knowledge Exchange Carer Advisory Group, and she's going to facilitate today's discussion. So I'll hand over to Karen. Thank you.
Thanks, Elena. And yes, I'm here coming to you from beautiful Wiradjuri country in the central west of New South Wales. And I'd like to pay my respects to elders past, present and emerging as well. I'm a carer of 38 years. Firstly, for my sister who had an acquired brain injury quite young, then my son with autism and an intellectual delay. We then went on for my parents as a carer and my father up until his death. Professionally, I've also worked within community services, supporting many carers across a range of contexts. I'm a consumer partner with the Carer Knowledge Exchange, as Elena mentioned, and sorry, I've just lost my thing. As I mentioned, and I sit on a number of committees that have to do with engagement with formal and informal services in a health perspective or a disabilities perspective, including end-of-life, palliative care, ageing. And I'm again engaging in further study, hoping to understand what actually happens to all our health data and to add a carer voice to in-hospital and preventative health strategies. So against that background, I've often been encouraged to believe myself as resilient. However, it's a term that doesn't sit quite comfortably with me because while it's true from a purely definitional point of view that I'm still here having bounced back from many challenges, how quickly that happens and what protection or insulation it provides for me for future setbacks feels far less secure. And I think there's a real need to better understand the consequences for carers across the life course of the push for resilience. And I say this with personal experience that each battle leaves its scars, no matter how well I'm perceived to have managed. And as I age, I'm ever more conscious that there are only so many battles I can manage and that sustained stress really does have a negative health impact. So today we are considering that empowerment and resilience are contested and often misused or misunderstood terms. Some consider them to be unrealistic goals that rarely represent the perspective of carers. As a key critique of these terms is that they shift the responsibility onto individual carers rather than addressing the systemic issues associated with caregiving. Furthermore, resilience and empowerment are frequently presented as linear, static goals, which can present and promote misconceptions around the ongoing nature of these concepts and the duality of empowerment and disempowerment. We're hoping through our webinar today to facilitate some deeper conversations around the concepts of empowerment and resilience, with the aim of moving towards a more constructive operational framework. We've got a really powerful lineup for you today, and we hope that this will not only spark your interest, but also some deeper conversations in our small group discussions towards the end of the session. So please make sure you stay and reflect with us on this really important topic. To start us off today, our first presentation is a conversation with two of our carers. They're going to share with us their experience as carers and will help our conversation in the practical realities of the carer role. Let me introduce Amanda and Jordan to you. Amanda cares for her brother with Down syndrome, and it's a role that began in high school. More recently, Amanda became a carer for her mother also following a spinal cord injury. And this speaks, I think, to some of the multi-layers of caring in Australia. She also works in the public housing sector and brings her professional experience today, along with her lived experience of caring. Jordan is our other carer who's going to chat with us today, and Jordan first connected with Carers New South Wales via the Young Carer program and has recently joined as a member of the Young Carer Advisory Group. Jordan's caring role also began in adolescence, caring for his brother with autism spectrum disorder and an intellectual disability. Amanda and Jordan have kindly agreed to speak with me about their caring role so that we can explore their perspectives on care empowerment and care resilience. Good morning, Jordan and Amanda. Lovely to have you with us. And particularly lovely to have you, Amanda. We know that there's a lot to do as a carer to be able to make yourself available for these sessions. So thank you for joining. We've got fairly limited time today, and we did want to have a good discussion and hear from you. So I'm going to sort of dive straight in, and to give you a moment to catch your breath, Jordan, Amanda, I might direct my first question to Jordan. Mm-hmm. Just thinking, as a young carer, Jordan, how much did you have to learn initially to be what you might feel as being effective in your caring role?
How much did I have to learn in terms of being a carer? Is that the question?
Yeah, how much did you have to learn to be able to be a carer and navigate systems and support your brother?
I think, well, I feel like a lot of carers will be able to attest to this, but obviously, like with a job or doing something like caring, I learned a lot of it just by doing it. So a lot of the systems in place was sort of left in the care of my parents, and they've taken on the majority of that work, and I've been involved in understanding the pains and troubles that they've had to navigate to go with things like NDIS, to work with people like companies that help support people like my brother to get into jobs and things like that. But a lot of the things that I've learned is on the emotional side. Obviously, growing up, like my parents are still taking care of me, they're taking care of my brother. So learning the difference in how much support was needed for me versus how much was needed for my brother. And that disconnect of like, it seemed like a lot of preference was placed onto him because he needed a lot more support in terms of things like getting into education and learning how to do all the necessitative life skills, things of that nature. And yeah, a lot of learning of that was like managing my emotions about that. And growing up, going to adolescence, or learning what a care, like the word carer is. Like before, I didn't know what the term carer was. I just knew my parents care for my brother, and that's just the fact of it. And then growing up to it, learning what that means, what sort of responsibilities they did in the background that I wasn't aware of, learning about that and starting to take on a few more of it, like doing things like taking around the house, helping to clean, helping to drive brother around to wherever he needs to go, things like that. So everything's a lot of life skills. Really.
There's a lot of life skills, a lot of family dynamics there, Jordan. There's a lot to take in initially. Yeah. Thank you. And Amanda, my question for you is, you work in the social services sector. Do you ever feel like you should come to the caring role with lots of preloaded professional knowledge? And does it ever feel like that impedes on your role as a carer? I mean, you've got a dual caring role.
Yeah, so I mean, the social sector is good. It's just in regards to sometimes I can probably overstep where my role is because I can see other people who are carers, and then I step in and be like, well, have you tried this? Do you get this through your NDIS and stuff like that? So I feel like I sort of take on two roles within the business as well, because, you know, being a carer, all you want to do is help people. And being a carer for mum, like my brother, I was like, with Tom growing up, it was more, I was always just there doing stuff physically for him, like helping him with his eating and stuff like that, teaching him how to eat on his own and things to make my parents' life easier. But then when everything happened with mum and she was the main one doing the NDIS payments, I used to have to sort of navigate that system. And it was very much, you call the NDIS helpline to sort of be like, oh, well, I need a bit of help with, you know, how do I start with this, making his payments and stuff. And then they revert you to the videos and go, oh, you just do this. And so that was a big challenge in my caring role. But yeah, it's very much learning very different systems and navigating them. Yeah, and with my brother, it's just taking on basically virtually like a parent role to him because I'm his main primary carer now. So yeah, it's dropping him off, getting him to and from work, filling out his work forms, filling out different forms for his day program, going to meetings where I need to for his employer yearly. So it does like impact a bit of my position at work, but my work is very flexible in regards to my caring role and what I need to do for him.
So I think what you just explained there is you quite often find a lot of carers working in social and community services because they kind of do it. And I think we've all sort of, you know, been able to very much put ourselves in the shoes of other people. So thinking about what today's seminar is about is that concept of empowerment and resilience. What do they mean to you? Might start with you, Amanda. Do you feel empowered and resilient, or is it a floaty concept? How do you view that term, those terms?
Empowerment, I don't really relate to. I don't feel so empowered. I think it's because sometimes you get so exhausted that you just don't really recognize that term. Resilient, I could probably feel a bit more of that just because of the fact, you know, you have to be a bit resilient to be a carer because there's constant challenges that will come up and, you know, you can never anticipate what that challenge will be. So you sort of do have to be a little bit resilient, but empowerment probably less.
Thank you. Jordan, how about yourself?
I very much echo the statement of what Amanda just said. Like, care empowerment is not a term I particularly like ever thought of, like, oh, I feel really empowered to be a carer. And in a similar vein, I think resilience also falls under that same definition of like, if you think of something as being resilient, it's something that can bounce back and return to like an original state. So like if we were to treat this as something that happened to us, like being a carer, coming back to a state of quote unquote normalcy, for lack of a better term. Like that term was always like, it's not something that I particularly identify with. Like the term that I might much more prefer that carers speak up and want to be is like perseverance. It's like working through becoming something better for both themselves, for the person they're caring with, things like that. So yeah, those terms are kind of like, doesn't really speak to me in terms of being a carer. So.
And I suppose, and I'll ask your opinions on those too, is I would rather not have to keep bouncing back. That would be my preference.
Mm-hmm.
And so from that perspective, I think, you know, the resilience is a lovely term, and we move in and out of our conversations around resilience, and it happens at various times, but it would be much nicer if we didn't need to have the armour of resilience around us. And I guess there's a lot of talk in industry around capacity building. We're wanting to build everybody's capacity, and it's a bit of a term that's threaded through the NDIS. What do you think about that when there are programs out there saying we need to build your resilience, we need to build your capacity, we need to empower you? Do you think that's putting onus on carers to do better and be better? Or do you think it's actually part of building a helpful toolkit of things that carers can use? Amanda?
First. Yeah.
So
I would say it's putting more onus on carers rather than, you know, building a toolkit to help us in a way. Because I mean, unless you're living the experience of what's going on within a household, and for a long period of time as well, because, you know, you might not notice it the first 2 weeks of being in that household, that how exhausting it would be, but then being there for a year is a very different story. So putting more ownership on carers would be more difficult, and make it more harder for us to get day in, day out sort of, you know, because the more ownership it would just be also, you know, navigating working full time as well, because I have the luxury of also being at work from home 3 days a week. So there's always, you know, if I was in an office full time, it would be so much more difficult if I had more ownership and more responsibility on my hands than what I currently do.
What do you think, Jordan? Do you ever feel that you need to be prepped to be resilient, or is that really factored into your caring experience?
Yeah, I feel like I've never really been prepped to be resilient. It's something I think we can all agree with, kind of comes with the territory. It's like, you have to be resilient. Like, you never went to a workshop, it's like, oh, now I'm resilient. And like, you know, someone told me how to spell the word resilient. It really echoes with me. Like, it's just a word to identify how I've been feeling. And in a similar manner, the term capacity building to me is like, we're not really giving more time to carers to do things we're doing. We're just expecting more out of them, which is sort of not aligned with things like what I imagine a toolkit or a framework would be. Like, if I would think about it in the context of my experience, which is like this engineering background, if you were to use a tool or a framework or something to help you do whatever it is you need to do, that would help you to narrow down your work, to narrow down what things you can reasonably achieve, what things can help you save time on doing things, rather than expect you to now be able to do this on top of this, on top of that, on top of blah, blah, blah. Like Amanda said, putting the onus back on the carer. So yeah, I feel it's a bit misguided. I appreciate where they're coming from in terms of we want to give power to the carer to be able to do the things they need to do best. But yeah, unfortunately, there's only so much time in a day to give capacity to, right?
So do you think it's about reframing how we're supporting carers? And as you mentioned, it comes from a good place. I'm really sure that we want to empower carers to actually manage their role. But is there another way to actually support people? Amanda, do you have any thoughts around that?
I don't know if I've spoken to this before in the past with like other meetings and stuff. It's just, I think having NDIS also recognise carers in their program as well. And I know that they don't really facilitate counselling services and things like that. Things that will help you over time and will help you day to day to speak about your issues to somebody external from the house is much better in regards to helping us as, you know, if we're not well in the mind, then we're not well enough to look after somebody that's, you know, physically or intellectually disabled. So it does, that's always been a big I guess, barrier for me, because I always think, you know, our family could benefit for stuff like that. Not just me, my father, you know, across the board. But it's not quite recognised, but, you know, it has been mentioned. So
do you think it's more of a whole of family, more holistic, complete person included lens that we need to be adopting?
Yeah, because if one goes down, they all go down. So that's what I know. Like, you know, if somebody's having a bad day in this house, the rest of the house is having a bad day, and it's just not good, you know. It doesn't make you feel very, you know, happy or ecstatic for the day. And then some days when you're having the best day, everything just aligns and everything's perfect and everyone's happy. But yeah, it's just those days where it gets a little bit tough that I think it sometimes needs to be recognised that there is carers external to just the person that's physically or intellectually disabled.
I think that's part of that very fluid, flexible carer experience. You know, as you say, there can be days and weeks even where everything's working, and then something will happen, or there'll be a change, or we hit a transition point, and all of a sudden we don't feel so resilient and we're struggling for answers. I don't know, Jordan, have you experienced that?
Yeah, I've definitely experienced that in the past where, like Amanda just said, like things are doing well for the most part some days, and then sometimes it's very full hands-on. Everyone's really feeling the burden, the emotional pressure, and it's a tough work for everyone. And like, yeah, caring is not a very stable thing. Like some days are good, some days are bad. That's just how it is. And I think really caring recognition, real empowerment of that would be like recognizing that the role of carers and how they take on, and the financial burden they're taking, the emotional burden they're taking, recognizing and be able to step up with that. And I think I've had talks and heard things with Carers NSW in the past where they're looking to address that. And I think that's a really good step in the right direction.
And I think, as Elena mentioned at the beginning of today's session, the care recognition work that's being done, there's still time to get submissions in, and they're the things that we need to be raising. So considering that, question for you both, because we're coming to the end of our time, what's the one thing that you would like policymakers, researchers and other people to know about the caring role? What, if you could tap somebody on the shoulder and say, this is the thing that matters most to me, what would it be? Do you want to head on with that one, George?
Yeah, I can head off. I think this answer just came to me instantly, like very straightforward. The most important thing to me as a carer is the person I'm caring for, just straight up. That's why I want to do a good job. That's why I'm trying to learn more about my carer role. That's why I'm trying to see all the problems that people have with their own caring experience and all the different things they have. Because at the end of the day, I think we all care very, very much about the people we're caring about, and we want to do the best for them. And we want them to have the best experience. So everything comes with the caring person in mind.
Yeah, and I think that's important to remember, even when we might be perceived as being critical of things. I think everybody's coming from that place of wanting to care. Yep. Just we need to have these conversations to unpack how we can actually do that in a proactive way. Amanda, your 30-second pitch to policy.
Yeah, I would say the same. I'd say, like, to me, first would be the person that I'm caring for, because I would probably never put myself first. But yeah, and then the carers that are associated with the people, because and mine would just purely be because my brother can't really advocate for himself because he's nonverbal and things like that. So if I wasn't in the picture, and you know, he could easily get taken advantage of by, you know, people or systems and things like that. So to me, he'd be the most like important. Mum's very verbal and she can advocate for herself, so I'm not too worried about her. But yeah, I would say the person and then the carer.
Yeah, and I can see some notes coming up in the care in the chat around, you know, the impact of emotional wellbeing on carers, but also on the person and the way we've reframed services around person-centred care. And as you say, Amanda, some of the people that we're caring for are particularly vulnerable because of their particular issues, and that make it hard for them to speak. So I'd just like to thank you both very, very much. I hope you stay with us to the end, and some people will be lucky enough to have you in their small group chat later, and they can probably ask you some more questions. But I think it's really valuable to always start these things by hearing from people who are out there caring, and like yourself, and particularly younger carers, because I think sometimes they're forgotten in the conversation. And you're both very young, because to me anybody under 55 is very young. And so I just thank you very much for that.
Thank you.
Thank you.
Lovely, thank you. It's now my very great pleasure to introduce Rianne Chin. She's the Senior Project Officer at the Older Persons Advocacy Network. And Rianne is passionate about building community capacity, there's that word again, through volunteering, quality and education. And today she'll be speaking about the Self-Advocacy Toolkit. And I just love this toolkit, and I hope you do too, because it's another thing that we can use as carers in our work and support of the person we care for. The toolkit aims to equip older Australians and their carers with the skills, the information and resources they need to speak up for better aged care. And it contains detailed, accessible information about rights and options for aged care services and support with common problems, risk of harm, decision-making and aged care costs. Rianne, we would love to hear from you, so I'm going to hand over to you. Thank you.
Thank you so much, and I'm so privileged to come here today. I am, as has been said, Rianne Chin, and I work as a Senior Project Officer at the Older Persons Advocacy Network. And I also have the privilege of living and working on the land of the Whadjuk people of the Noongar Nation. So I'm across the country in Western Australia this morning. I pay my respects to their elders past, present and emerging, and to any Aboriginal or Torres Strait Islander peoples who are joining us today. I also speak from the perspective of I care for a family member who is 95 and living with dementia, living at home on a level 4 home care package. So I've been able to bring that perspective as well as that of an advocate and I suppose a professional in the sense that they're paid advocate. So for context, the Older Persons Advocacy Network is a network of 9 service delivery organisations. There is at least one in each state and territory across Australia. Each of these organisations provide individual aged care advocacy to older people and their representatives in their jurisdiction. So I've been working at OPAN for 2 years now, and prior to that I worked for Advocare, who are the advocacy organisation here in Western Australia. And reflecting on what Amanda has just said, I'm really conscious that empowerment is a central concept of individual advocacy, but through my work as a senior advocate and advocacy manager and my own lived experience, I certainly acknowledge that interacting with systems like the aged care one generally leaves people feeling absolutely the opposite of empowered, but certainly a need to be resilient. So what I'm going to try and do in the reasonably brief amount of time I have today is briefly explain OPAN's perspective about systemic versus individual advocacy. And then I'm going to quickly demonstrate some of the features of the OPAN self-advocacy toolkit that I've been part of developing as part of our advocacy community network development project. And yeah, I am really passionate about that. It's been developed as a tool that people can use as much or as little as they want, and that always with the principle that for people interacting with the aged care system, that they have the right to an advocate, and there always is an advocate available that's able to support them. So I very frequently find myself in this conversation where we're talking about those principles of, well, I suppose that the statement that's given is like, you're telling us that you just need to do this, but actually the system needs to change. And we wholly acknowledge that the system needs to change. And I think that one of our principles at OPAN is that we support older people to bring their voices to the table, to advocate for themselves, and to enable systemic advocacy based on their voices and experience to drive the transformation of aged care. But we do this principally through individual advocacy. So OPAN is the, I suppose, delivery organisation of the National Older Persons Advocacy Programme, which means that there's quite significantly more than 100 advocates throughout the country. That will continue to grow and has grown significantly since the Royal Commission into the Quality and Safety of Aged Care. So all OPAN advocates across the country follow these principles, and I'm not going to go through each and every one of them because I'm very conscious of the time. And but what I did want to highlight is that capacity building and advocacy services have a strong emphasis on strengthening the capacity of older people and their representatives to self-advocate. So that was the thinking behind the development of the self-advocacy toolkit. Always central to what we do as we develop resources for people at OPAN is that the older person's perspective will always be, and voice will always be, central to everything that we do. As we were developing this toolkit, though, I think that the concept that I've referred to, that it's so important that at any point, if someone doesn't want to advocate for themselves, that they can pick up the phone and know that there's somebody who's there, who can support them. If you can recall from the previous slide, they are partisan, they will be completely on their side. So as we develop this toolkit, the voices there are the older person, just an amazing woman called Gwenda Darling, Jared, who is an aged care advocate. Both of these people actually live in New South Wales. In fact, I think all three of them do. And Lorraine, which is, I'm going to show you a very brief excerpt from some of the fairly simple videos that we put together to highlight, just in real terms. We base them on real advocacy case studies, or how advocates go about it. So people could really, I suppose, see themselves, hopefully, in sort of ways that they can address common issues in aged care by using the toolkit. So as I've touched on, that the other elements of the toolkit were that advocates would know that they could go and maybe go to a meeting with a residential aged care facility or support someone to do that themselves, and that there'd be resources. So all of this toolkit, what you can see here is that the videos that you're about to hear is there.
See that their quality of life is cared for or is thought about.
Good brain.
I don't want to be difficult, but I do want Ron's rights to be heard.
Understanding what you can reasonably expect from your aged care provider allows you to speak up. The Charter of Aged Care Rights and the Aged Care Quality Standards provide clear guidelines. And remember, professional advocates like myself are here to help if you get stuck or need support. That's all the issues.
So the reason I wanted to show that particular clip is Lorraine's perspective of, I don't want to be difficult, but understanding how complex, and that example is an example of that. Interacting with these systems is, and how advocates can support people can do them, but as they do so, there are tools that can be left that can empower people and be able to do that. So these principles were very much that this toolkit is accessible and translatable. It can be useful and interactive, but also current, because the aged care system is constantly changing and is up to date. We have a hard copy available, but each page can be saved and downloaded, so somebody can take something with them. And additionally, the checklists of very common issues that people are able to do are there for people to have as an aid, but really support older people to have a voice and to really have time to gather their thoughts and make sure that they can articulate what's important to them in the process. So I hope that hasn't felt too rushed. There was a lot to get to. There's a lot in the toolkit, but I do hope for those of you that do need to interact with the aged care system, that's useful. And if you have any ideas on how we can make it better, please do let us know, because we are updating it all of the time.
Thank you so much, Rianne. And it is really good. And I'm sure we're going to put some links and things in chats and whatever around how to navigate your way to the toolkit. One of the things that strikes me is that in the discussions and the preparation for the NDIS and for My Aged Care in its various iterations, the one thing that gets left out constantly is the need for advocacy. And, you know, we're now sort of trying to patch that with these conversations around empowerment and resilience. And I think particularly in an aged care space, people still feel very much that fear of retribution and nervousness about contacting someone who's got an advocate name. What would you say around some people's hesitation perhaps of giving an advocacy organisation a call?
It's really clear in the Charter of Aged Care Rights at the moment that, well, firstly, that someone has the right to an advocate to advocate on their behalf. But I think as we've talked to in terms of how people feel about empowerment and whether that speaks to them, that they're still nervous, particularly in a residential aged care setting where it's their home. And if they're making a complaint, they fear retribution. And that's also a really important right under the current Charter of Aged Care Rights, is that you have the right to complain without fear of retribution. It is also the case that that sort of thing is not clear cut. So people in residential care, for example, feel that, well, it might be that there's nothing clear cut, but I'm feeling excluded by the staff. They're not the same as if I raised a complaint. But that's absolutely where advocates can come in and support people. But I think it's also true that, well, I know it's also true that the vast majority of organisations delivering aged care, and I think as we say in the toolkit in terms of that process of making complaints, want to know, like they want to know how they can improve. It's also a key element of the current quality standards, which are in the process of being strengthened, that service providers have to show how they support people to be able to give feedback and make complaints. So certainly as advocacy organisations, as well as providing individual advocacy, part of the role is to provide education to groups and residents living in aged care facilities, as well as receiving in-home care. And one of the key areas when residential care facilities are unwilling to have that education is, look, this is helping you actually meet the standards that are required of you. The other really good development, and there's consultations happening around the country at the moment in terms of aged care, is that right to an advocate is in those draft principles of the new Aged Care Act as well. So it's a really central principle of how aged care and how the new rights-based Aged Care Act would aim to have those older persons' rights central to aged care, as opposed to how we fund providers, which I think has been the case up to now.
And I think, you know, the role of an advocate can be around information and supporting and helping somebody think through the issues. It doesn't necessarily have to be deeply embedded in a complaint or an adversarial situation. I think advocates can bring a lot to the table, particularly in early days when people are still trying to work out how everything works, and to reasonably test what they're asking for. You know, should I be expecting this or should I not be expecting this? What do you think, Rianne?
That's a fantastic point, Karen. The principle I talked about a little bit earlier, that advocacy is directed by the person, so which is quite separate to person-centered, if you want, which is that any action or outcome agreed with an advocate is directed by in the case of OPAN, the older person or their representative. So if all they want from advocacy is to talk through those issues and to work out what the outcomes they're looking for are, then that's absolutely all the advocacy would be. And that again is a really important reason to contact an advocate in that situation. I think the other part as well is that we've had pieces of research. Dr. Barbara Blundell at Curtin University has done a lot of that, and one of the things that come through is that a lot of people report that they are better even sometimes when the outcomes aren't delivered, they do feel better as a result of engaging with advocates, just by going through that process and having somebody who is partisan and who has that strengths-based approach of, well, what outcomes are you looking for? I mean, what do you want? What does mum want, or where that sits, so you can make sure that those wishes and needs are central.
Because there's a lot to know, and you don't know what you don't know. I can remember when my son was very young and we were going through the education system, I used family advocacy here in New South Wales quite a bit, but they didn't take over. They gave me information and they helped me build the right arguments and the right approach and within what the law allowed. Anyway, as I said, I think it's one of those things that was sort of missed when we were redesigning support systems, that there would still be an ongoing need. You know, we can build all the capacity we want, but there's still an ongoing need for people to assist us in this advocacy environment. So, Rian, thank you very much. You've been excellent with your timekeeping, and I just want to thank you. If anybody has any questions for Rian that we can't get to today, please pop them in either in the chat and they'll get picked up, or I believe there's an email address floating around in the chat as well. You can send things through, and I'm sure Rian will be happy to respond to those in due course. But thank you very much.
Thank you.
Thank you for giving us a toolkit and yet another information repository where we can build our resilience and become empowered. So thank you. I'd now like to introduce you all to our next speaker, who is Dr. Rebecca Laidser-Powell of the University of Sydney. Rebecca is a behavioural scientist and Cancer Institute New South Wales Early Career Research Fellow within the School of Psychology at the University of Sydney. The goal of Rebecca's research is to improve the clinical care and psychosocial wellbeing of people with chronic health conditions and their carers. Rebecca herself is internationally recognised for her work on the involvement of carers in the clinical triad: health professional, patient and carer. She's led development of the world's first clinical guidelines and online education to improve health professionals' communication with carers. And these guidelines have been used within policy nationally and internationally. Rebecca is passionate about family carers, feeling that they are involved and supported within the healthcare system. She also has lived experience as a family carer and a deep understanding of the rewards and some of the challenges of supporting someone with a chronic illness. I'd now like to hand over to Rebecca. Thank you.
Thank you so much, Karen. And it's such a privilege to be here today to talk to everyone. So I'm coming to you today from Darawal country, and I also would like to acknowledge the traditional owners of the lands that I'm on today and pay my respects to elders past, present and emerging. I guess I'll jump straight into my talk today. Karen's given you a bit of a background on the work that I do as a researcher at the University of Sydney. So in terms of my main research areas, I just wanted to give a bit of context to kind of the world that I sit in within my research. So I mainly look at the psychological impacts of living with chronic health conditions, and my special interest area within research is family and friend carers. So the other element of the work that I do is also around health professional communication. So really providing education and training to health professionals in how they can best communicate with and engage with people living with illness and also their carers. The other thing that I do a lot in my research is developing and testing interventions. So things like education and support programs to help upskill health professionals, to help provide support to carers. So I'll give you a bit of a caveat that a lot of the research that I do is among adults with chronic physical illness, so carers of adults with chronic physical illness, and this is often cancer. So hopefully what I present to you today will still be relevant to many of you, but it does have a bit of a kind of cancer lens to it, just because that's the main area that I work within. Okay, so today's talk, I really want to talk about two main areas of my research. So the first one being the crucial role of carers in the healthcare system. And when I was reflecting on today's talk, I thought, you know, a couple of questions for myself was, what does carer empowerment look like in healthcare? Who's responsible for empowering carers, and how can it be done? And then also the other element that I wanted to think about was supporting carers who are experiencing distress. So, you know, carers who have unmet, you know, needs, who are experiencing, you know, overwhelm or anxiety and depression. And some questions that I was asking myself about resilience is it fair to expect carers to be resilient by themselves? And how do we get the right support for carers? So these are some of the topics that I'll be talking about today. So on that crucial role of carers in healthcare. So we know that carers often assume substantial healthcare responsibilities. And this would come as no surprise to all of you that carers take on a huge number of different roles. So arranging and attending medical consultations and treatments. They, you know, oftentimes take on multiple medical roles. So things like information support, helping with, you know, making complicated treatment decisions, and also advocating for the person with the illness. Also, you know, it doesn't stop as you leave the hospital or the treatment room. That for carers, this is often, you know, this caregiving oftentimes extends into the home setting, providing supervision of perhaps side effects of treatment, symptoms, and then also helping to enact lifestyle and medication adherence. So in the research that we've done, we've come to kind of understand a number of different things that can help or hinder carers being involved in healthcare. So a number of the carers that I've spoken to in the past in our research have talked to me about there's been times that they've been made feel kind of unwelcome or ignored in medical appointments and in the healthcare setting. Some carers just physically can't attend consultations, so they have work or other caregiving responsibilities, and that can really impact on their involvement. Some carers are a little bit unsure about what role they should assume in the healthcare setting. So oftentimes, you know, there's not a clear-cut role for some carers. Therefore, perhaps they don't speak up to the extent that they would want to. And for many of the carers that I've spoken to, they really do appreciate when health professionals connect with them, acknowledge the value of carers and respect them, and communicate with carers. So what might carer empowerment look like in healthcare? So these are just my kind of main thoughts that I had. Is carers feeling welcome and included in conversations with health professionals? Having their informational and emotional needs assessed and met. That carers who are experiencing distress are referred to appropriate and timely support. That carers can contribute to healthcare decisions, particularly when those decisions affect them, or they are, you know, really heavily involved in the enactment of those decisions, that carers are part of that conversation. And that carers can feel able to speak up in the healthcare setting. So that might be speaking up on behalf of the person with the illness. You know, if they are in hospital and something doesn't feel right in the care that they're getting, is feeling empowered and enabled to speak up, and also feeling able to speak up for their own needs and for their own, you know, if there's information that they need or if there's support that they need. So that's kind of some of the things that empowerment looks like to me in the healthcare setting. So I've been working in this space for about 12 years now, and we've done a lot of research into kind of the involvement of carers within the medical setting and within triadic, which is, health professional, patient, carer, communication. So we did a systematic review, and we've done a number of qualitative, so interview studies where we've spoken to carers, to oncologists, to oncology nurses, and to people living with cancer to better understand the role of carers in the cancer setting, and also to really think about how carers are involved and how we can better support carers in this setting. We also did a really interesting study where we took audio taped consultations. So we had 72 initial consultations with an oncologist and a patient and a carer. So these were real consultations that had been audio taped and transcribed. And then we coded them to see what was actually happening with the carer in these consultations. So what kind of communication was happening with carers? And it was really interesting. So some of the kind of key points to talk about here are that only 18% engaged in, and I call it social chat, but it's really like understanding the carer. So asking the carer about themselves, or making it like an attempt at connection with the carer. So that only happened in 18% of the consultations. 10% of the consults, the doctor invited the carer to ask questions. So said, do you have any questions? A quarter, the doctor asked the carer a question. So oftentimes that would have been asking, do you remember when, the person you're caring for was diagnosed? Or do you remember, getting some information from the carer? So I guess what you can see with these first three is there's not a lot of initiation from the doctor towards the carer. But what was interesting is that when a carer did speak up, when they did have questions or comments, most of the time the doctors were actually really fully responsive. So we coded for if they ignored it, responded to it a bit, or fully responded. And so I think that was kind of interesting that the initiation piece wasn't there with the doctors, but they were actually quite responsive when the carer did kind of initiate a conversation. So I guess some of the things that we were reflecting on is the fact that in our qualitative interview work, there were some carers who were feeling a bit unwelcome. Some carers couldn't attend consultations. Some felt unsure of their role. And if you piece this with the fact that few oncologists were kind of initiating communication with carers. The other thing that this is in the sort of broader context is that there's very limited health professional training on how to communicate with carers. So there's very little at an undergraduate or a postgraduate level or at a professional development level where health professionals are actually taught about carers and their needs. So I guess what we kind of think that this results in is that there are some carers who are not being sufficiently engaged, informed and supported in our healthcare system. So with this in mind, we developed something called the TRIO guidelines. And this is evidence-based practical guidelines for healthcare professionals to build effective carer involvement. So I published these as a booklet and also published them in an international journal. And what it goes through is some really key steps for oncology health professionals in initiating and encouraging the involvement of carers. And within each of these, we also give kind of key wordings of how a health professional can enact these and what are some of the steps and strategies. I've also then now transformed this into online education for health professionals. So we took these evidence-based guidelines and then transformed them into an online education program for health professionals. We had a group of experts give us feedback and helped us with the co-design of this framework. And we had a professional web development company who created the website. We filmed professional videos modelling key skills on how to communicate with carers. And the learning is interactive and reflective. So as you can see here, it covers a lot of different topic areas that clinicians can learn about in engaging with carers. So we did a pre-post evaluation of this. So we looked at health professionals before the training and we looked at them afterwards. And what we found was that having done this, afterwards they reported significantly increased confidence in their engagement with carers, and this was sustained 3 months after receiving the training. And I think part of one of my aims over the next little while is really around extending this beyond the cancer setting, because a lot of the principles here are broadly applicable to all health professionals across Australia. We also created an online education program for carers themselves. And this is around, discussing, it shows, videos of clinicians discussing the key values of, the key value and importance of carers. And again, some of that skill building around how do you practically advocate for a patient's needs in a hospital setting? So what are some of the steps that you can take? And we also developed a person living with illness complementary program to really help them understand how to work alongside their carer. So I guess what we've done in this program, and reflecting on that question around who is responsible for carer empowerment and how can it be done, our work has taken a really 360-degree approach to carer empowerment. So, not only engaging the carer themselves, but the person who's living with a chronic illness, and also the health professionals. And I think a really key part of this, and I'm conscious of the fact that of the speakers that we've heard before, not overwhelming and giving carers more work to do, that there's a really key role of health professionals in this, in empowering carers, and they need to take on a lot of the responsibility of this. Some of the key strategies, I think, from the health professional side of things are really around professional education for all health professionals on how to engage with and support carers, and also broader health system changes to better allow carers to be engaged with in healthcare. So, greater responsibility for carers in our healthcare system, increased consultation time so that carers can actually speak up and have their information needs met, and also dedicated Medicare billing for consultations to have with carers. So I guess flicking now to the next topic area that I'll spend just a couple of minutes on is around supporting carers who are experiencing distress. And now we know that this is very common amongst carers. And I guess the questions I was reflecting on were, is it fair to expect carers to be resilient by themselves? And how do we get support to carers? So we know there are lots of benefits of being a carer. So a sense of meaning and purpose. For some, there's enhanced relationship and connection. Some people, report a sense of personal growth and accomplishment and learning of new skills. But this is not experienced by all carers. And it's certainly not experienced by all carers all the time. And I think it's really important to acknowledge that. We know that anxiety and depression rates are 2 to 3 times higher among carers than in the general population. And in the cancer setting, depression and anxiety among carers is actually at the same or higher levels than among people with cancer. We also know that there's high levels of unmet needs. So these are needs that carers have that are not being met by our healthcare system for both information and their emotions. Carers that I speak to talk about feeling overwhelmed and exhausted and taking on many roles, many responsibilities, and with little time for themselves. And with that, can come feelings sometimes of feelings of guilt, of taking time for yourself, or of going, I'm not the one that's sick, and therefore, maybe I shouldn't be taking time for myself, which is completely, against what we know to be important for carers, which is taking time to look after themselves. Carers also report, sadness and isolation. So that's, obviously there's a lot going on psychologically for carers. So we do have avenues of support. Avenues of support include psychologists, social workers, your own kind of informal networks. But there can be barriers. So barriers to time and cost, the availability of getting in and seeing a psychologist, and also of understanding caregiving experience. So that's why I was really thrilled this year to get a fellowship. So I'm funded by the Cancer Institute New South Wales, who gave me a fellowship to design targeted online psychological therapy for cancer carers. And within this, there's routine screening of distress among carers. There's stepped care pathways, matching support to carers, depending on the type and intensity of need that they have. So obviously, carers not experiencing high distress, they don't need an immediate referral to a psychiatrist. There's matching the needs of a carer with support that would be appropriate to them. And I'm also designing and testing a program called Carers Can Adapt, which is online psychological therapy specifically for carers experiencing distress. So it's using established cognitive behavioural therapy, so CBT approaches. It covers, carer-related challenges and strategies, and it's built for carers with carers. And again, my sincere hope is that I'll be able to translate this beyond the cancer setting so that this kind of resource is available to all carers across the country. So going forward, is it fair that we expect carers to be resilient by themselves? I think absolutely not. I think carers need to be provided with timely, targeted and effective support. And how do we get this right? And how do we get the right support for carers? That one, I'm still working on part of that answer, but please stay tuned and hopefully I can come back at the end of my fellowship and report back. Thank you so much for the time. And if anyone has any questions or would like to get in touch, my email address is there.
Thank you, Rebecca. In listening to you, I kept feeling like this feels like the missing piece to the whole person-centred discussion, because we've been so focused on the actual person getting services in the health setting that we forget that there is a whole psychosocial environment and support network that is there with that person. And I think I said to you when we first met, it feels like the carers get excised off because we're focused on the person, which is not what the true intent of person-centred was meant to be about.
Absolutely, absolutely.
Yeah, and I think that was borne out by your study that showed in those conversations that when carers asked questions, that they were actually spoken to and they got their information, but there's no initiation because people tend to get very focused on the person themselves.
Absolutely, and I think there's no training in how, or there's very limited training in how to effectively engage with carers, which I think, every health professional I talk to, they really do value carers. But it's just for many of them, they've never been taught or modelled how to do that appropriately within the framework that they have to operate within.
But I also think, Rebecca, you're giving them permission to actually engage, and I think that's the part of person-centred, that people feel that they need to focus solely on that person that's sitting in the chair before them that they're treating. And your work is actually giving them permission to actually look more broadly and more holistically at what's happening. And I think if we think back to an early comment I think Jordan made, it's about that whole of family approach, is how we actually support everybody in the best possible way. You've generated lots of comments in the comment box, and I'm sure
I'll go and have a read right now. I've had it all closed off while I've been presenting, so I hope there wasn't anything that I should have addressed, but I'll certainly read through them all right now.
No, the team is definitely on it. But I think it's all the more important because I think there's going to be a lot of this discussion come up in our breakout groups. But please, I'd just firstly like to thank you so much, Rebecca. I'd like to thank Rianne. I'd like to thank Jordan and Amanda. You've all been incredibly generous in sharing your knowledge and your experiences. I'd also like to thank Elena and the team at Carers New South Wales who help us facilitate these conversations and who actually are raising some really important things for carers, and I just want you to know that it's much appreciated. So I'm now going to hand back to Elena. I will see you all again when we return from our breakout groups, and we're going to have a round conversation about what was discussed in those sessions. So thank you all.
Great, thanks so much, Karen, and thank you to all of our fantastic speakers this morning. I think we've really had a real breadth of discussion, and viewpoints around empowerment and resilience. But also I think then importantly with Rebecca and Rianne, some of those solutions and things that can be developed to empower carers, which is really important. We're now going to move into a series of breakout rooms for around 25 minutes. And you'll be allocated a breakout room where you can contribute to further discussion on what we've just heard from our speakers. but also probably looking at, I suppose, what the impacts, or what really does empowerment and resilience mean for carers. And I think we've seen some of the great solutions about how we can actually create that empowerment for carers. So some of the questions that we'll be discussing in the breakout rooms, which are on the screen there: do you think the terms empowerment and resilience are useful in relation to carers? What appeals to you about the examples presented today of rethinking these concepts? And what new evidence do we need to understand the subject more? So if you can just wait, there'll be some instructions on your screen. And after the groups have concluded, we'll all rejoin the main meeting. If you don't want to participate in a group, that's fine. You can stay in the waiting room and then rejoin later. So the team will be allocating those groups to everybody. And then look forward to the discussion that will happen there. And then Karen will come back as well with myself to feedback some of that discussion. Okay, thank you.
Lovely. That sounds like we've got everybody back. I'm quite keen to hear what the discussions were in that 25-minute or so break. I'm just wondering if we can start with Group 1. If you've got your spokesperson there, if you could come and share the discussion with us.
I believe that's me. Is that correct? Yes, fantastic. Just checking. So hi, everyone. So in Group 1, we had a very rich discussion. We had a number of carers and also people that are working in service environments. Very brief summary. One key point was that carers are resilient. Whether they feel it or not, others perceive that they persevere through challenges. And we were interested in the idea that resilience may be perceived by others but not felt by the carer, and that's something worth exploring. The second key point that came out was that empowerment is different. It actually involves choice and impact, which many carers don't feel that they have the choice or the impact, and therefore they feel disempowered. But a really interesting thread that came out was that where carers find empowerment is when they're not on their own. And so empowerment as an individual, as an isolated individual, might be difficult, but it's when carers are recognised by service providers, it's when carers find other carers to kind of work with, and especially if there's a purpose around making change for others, that's where a sense of empowerment comes in. So I think that was a really strong theme for us, was that empowerment happens together. Yeah, I think we were just talking about how service providers really need to see carers and recognise their role as partners in care, and also just, I guess, share some of the responsibility around carers' wellbeing and not just expect carers to hold that on their own shoulders.
That's really interesting. It's interesting that you separated out the two concepts of resilience and empowerment, and I really, really like that, actually. And also that insight around it depends on which view you're viewing a carer as, about whether or not you think that they're resilient. And I guess that goes back to my early comments. A lot of people say that I'm resilient, but from my side of the fence, it doesn't feel that way. And Sarah, you've seen me as some fairly low ebbs. It's this thing that at times you feel resilient, at times you don't. So that's really some very useful reflection there, I think. And I think there's some further pointers there for what we need to be looking at, and some other research opportunities, I would think, around that self-view, external view, and the difference between the two. And I particularly love the thought of carers, when they're together and they're working together for the greater good, that actually feels empowering. And I think that's incredibly true. And that's why things like the Carer Knowledge Exchange and workshops like today are so important, that's giving people voice and bringing them together. So, yeah, I think that's wonderful. And my own personal perspective, I know I've learnt far more from other carers about caring than I have from official sources. So I think that, again, reinforces what your group was saying. So thank you very much for that, Sarah. It sounds like it was a fairly full and rich conversation. You went quite deep. Lovely, thank you. And who is our second group speaker?
I am.
Prue.
Hello, Karen, and everyone. So our group, we had some really interesting discussion. Everyone in the group actually had some form of caring experience, which was quite wonderful. However, there were individuals working within the service and health sector as well. And one of the key things that kind of came out of our discussion was that these terms feel a little disrespectful and perhaps insulting, because when there is empowerment and resilience being spoken of, there needs to be action to support that. What's really happening here is those terms puts it back on the carer. And so the carer is empowered because the system is so difficult. If the systems worked, they wouldn't need empowerment or resilience because they would have support. Systems should be designed to work with one another, and empowerment wouldn't be needed. The systems don't link up well, which is bewildering and, in fact, disempowering. One key point that came up was, people coming from a very successful career, earning, a living wage, and then going into a caring role and only earning $250 a fortnight to engage in the most difficult work they've ever done in their life. So of course that develops resilience, because all of a sudden you don't have the luxury of living the lifestyle you had before or being able to afford basic creature comforts. So you have to, figure things out on your own, as well as look after other individuals. One lens that was also shared was, until these systems are at a capacity that, empowerment isn't necessarily needed, there is importance in feeling empowered to advocate. So being safe to advocate is important until it's not needed. Another little lens that was spoken about at the end, which was really quite lovely, was talking about elevating the carer status to recognize the tremendous work they do in the community, so that they are recognized in a similar vein to firefighters and nurses, recognizing that carers are underpaid and under-resourced and not truly appreciated. Empowerment is acknowledgement to elevate the status of carers and the amazing work they do. Carers are currently set up for failure, which forces resilience. So how can we care for the carers in the industry and create that acknowledgement so that they do feel empowered and seen?
Wow, this is really turning up some deep discussion. So, when you're speaking, I'm thinking, is it resilience or is it gritty determination that carers have? And I think there's a slightly nuanced difference there. But you're quite right, because many of us fight for whatever scraps we get given through the social security system, and a good many of us receive no formal payment because of the way the system is set up. And so that really denigrates the identity of carers, because you feel like you're constantly fighting. You're constantly fighting and on the back foot, and that makes that everything feel harder than it needs to be. So I think, your group, coming from that very strong carer perspective, has really raised that issue. And again, Elena mentioned it at the beginning of today, as around the piece that's now being done around care recognition. So it's really important that we keep talking about it and we keep raising it. We don't live in a utopian world, so nothing's ever going to be perfect. But if we keep chipping away at it, perhaps we can get there in the end, to something that's a bit more manageable than what it feels like at the moment. So
and personally, I think this Carer Knowledge Exchange, these webinars, these conversations are that first step, empowering carers to speak directly to service providers, researchers, policymakers. So, one step at a time.
Yeah, it is one step at a time, and it's not that we want people to take us over. It's just we just need something that's a little softer place to land than where we're currently sitting. So thanks for that, Prue, and thanks to your group.
Thank you.
Group number 3.
That's me, Arpita. Good afternoon, everyone, and thank you so much for this beautiful session. So we had in our breakout room, we had a variety of people, amazing people, from practitioners to carers to researchers and of course to professionals. So we came up to this conclusion that yes, carers are definitely resilient and they are so flexible. They that they get to learn things by themselves because they know it's either we or no one else. And simultaneously, when it comes to empowerment, it's a holistic approach which could come with the help of clear, precise communication, and we all are responsible for that empowerment, be it the service providers or the carer itself, health experts, government agencies, policies and programs, everything. So this holistic approach, this support will definitely bring empowerment. Simultaneously, we also discussed that educating professionals is the most important requirement, because we had this amazing session where we shared that the health professionals, instead of including the people who are actually going through, they discuss with the carers. Why? They need to be part of this communication conversation, what is actually going to happen to us. And simultaneously, I call it, this is my personal statement, that carers are ordinary people with some super amazing, supernatural, superhuman powers in them, that they actually work a lot, they actually multitask a lot, and they have information from all the aspects because of their passion. But simultaneously, though they are consistent, we need to provide them support, and this is how we wrapped our session. So thank you.
No, that's terrific. There's two things I want to say there is, if anybody's ever looking to employ someone, employ a carer, because the diversity of our skills that we've had to develop over years is extraordinary, particularly around multitasking and time management. And then the other part to that is around it. I think in the modern context, a lot of our family and our more traditional kind of support systems, they're quite widely dispersed. And so it becomes even more important for those structures and community and that to come together. As you say, you know, bring us all together and support what we're doing, but also understand, and for the people, the professional people that we're interacting with, for them to also understand that, you know, when they close the door at the end of the day, we might be on our own for a very long period of time. And that takes a fair bit sometimes. Sometimes there's some scary nights, and sometimes there's some tearful nights, and sometimes there's some wonderful nights.
Absolutely.
But yeah, I think the dynamic of how we're all living these days is changed. So that's wonderful. Thank you so much, Peter, for summarising that for us. So are we up to group 4 or 5?
Yeah, 4 next. Hi, Karen. I'm Wendy. I'm talking on behalf of group 4. It won't be surprising that not a lot of the group found any connection with the words resilience and empowerment. We're seen sometimes as buzzwords that get thrown around. People are often resilient by default, and the word resilient can be triggering for some. I think we talked a lot about the need for systems to do better. So the onus is on carers to be resilient, to build up their knowledge, build up their capacity. So the group sort of mentioned, what about invisible carers, carers that don't have the time or the energy or the skills to learn what they need to know? And I think you might have said it yourself, Karen, that people don't know what they don't know. So we talked about, it'd be great for carers to have a toolkit or a toolbox that they can dip into and draw on when they need it. But that really needs to come from the institutions that are working with carers to better understand their needs and include them in decisions. That knowledge translation also needs to be an accessible format for the individual person that needs that information. And I think something that really resonated for me, Peter sort of mentioned, if we looked at caring as a workplace, would that be acceptable to give carers a level of responsibility that they're carrying without the training and the skills and the support? And if we look at the hours that some people are delivering as well. But definitely great to have a toolkit or a toolbox to draw on over time as people's needs change and they need new information and new skills.
And I think you raise a really good point that, well, I suppose in all industries, you end up with buzzwords and terms and phrases that come in and out of fashion. And resilience, empowerment, and capacity building seem to be our buzzers at the moment. And I think it shades what's actually happening for people in those moments of resilience and what they think of empowerment. and I feel a bit like your group, you know, there's certainly times when people say that you're so resilient, and then they stop supporting me, and then I'm left out there on my own, and I suddenly don't feel so resilient or empowered or included or anything. So there's a lot of, I think there's a lot of unpacking and learning yet to be had, and I hope that there's lots of researchers and practitioners out there who'll watch this session and hear what our groups have had to say. But I think the other part to it is the development of the toolkits, and you know, we've got OPAN's toolkit that's starting to address some of those things for people who are supporting older people. We've got the Carer Knowledge Exchange, but we really need to get the message out more broadly about those things being there. But I'm also hearing what you're saying about not every carer has got the time to do that research. And it's a bit why I always push providers and others to have video vignettes, short video vignettes that people can tap into late at night when they finally get 5 minutes to themselves or they're trying to solve a problem. So, you know, it's about pulling all of that stuff together. And for those carers that don't have the time at this point in their lives to actually get on board and do some of this other stuff, that the rest of us who are around who can continue to speak up for carers. I would love to hear from Group 5, which I think is our last group.
Yeah, hi everyone, my name's Matthew. I was a facilitator of Group 5, and I think especially that last conversation, Karen, that you had with Wendy sort of really captured what our group was saying as well in regards to it. Our group, we talked about how resilience and empowerment words were too professional or academic, and I know one carer said that they found it not relational or relatable, and I thought that was a very interesting way to frame it. We had some carers talk about stoicism and the importance of knowing what you can and you cannot change. We had people saying that sometimes they found that idea of resilience was actually put up boundaries between people, and it stopped, as I said, it stopped it being relatable for people and made people feel isolated. A lot of reactions, you know, you must be strong, or, you know, sorry, you must be strong. And sometimes as a carer, you don't want to be strong. You just not acknowledge that you want help. One conversation we had about was, you know, a word that might be handy was authority. You know, what we need is not to be resilient, but to have authority, and to have an actual right to say, to have that say in the room with a doctor or a service provider. One benefit of the words empowerment and resilience was that for those that were in support groups or peer groups, you know, to take those words back to their groups and have that conversation within the group about what do these words mean for you, and to sort of like have that conversation with amongst the members, and let people sort of have their expression in regards to it. I think one of the importance of all the one of the importance raised was having all health professionals trained in understanding and supporting carers, and extending the 360-degree tool model to all health professionals. I know in our group that really resonated with a lot of people, the 360-degree model. And one of our comments, which was coming from the notion of mental health, was it's not about a recovery, but it's about a healing journey. And so for carers, we had a bit of a discussion about, you know, focus on the healing journey of the carers, and what does that healing look like in their self-care journey. We know that in caring, there's a lot of grief and loss and various emotions that come up, and so that was an interesting way of reframing the journey for many of the carers. Yeah,
and I think that reframing is great. I'm listening to you talk, and I'm thinking, you know, there is a reframing, and the stoicism really hit a mark with me as well, in that, you know, you get into this mindset and you get this persona applied to you that you're a stoic, resilient kind of person. But the reality is underneath, there's vulnerabilities as well for each and every one of us, no matter how strong we might think we are. And, you know, I'd like to see us have a more open conversation, an authentic conversation about some days are great and some days aren't great, and there's no right way to be a carer. And I suppose the discussion that you've had sort of raises that other issue for me, is that once we call people resilient and empowered, it's an endpoint in caring, and it's like you get your badge in caring. But I don't think there ever is a badge in caring, because it changes every minute. You know, it's like lots of things in life. You can't program out and you can't describe what the perfect care is. And I sometimes get concerned when I hear those phrases that newer carers or carers who don't have the resources other people have feel that they're in some way not doing the right job. And I think that's the danger in some of these terms. So thank you, Matthew.
Thanks, Karen.
I'll leave that there. Now, I just want to thank everybody for their amazing contributions through that discussion. It was clearly a very deep and penetrating conversation, and there's been lots of really good things come up. I'm very encouraged by what I've heard today, and I'm very thankful that we've been given a platform to be able to do that. So without much more conversation from me, I just want to thank everybody once again. Thank you all for participating, and I'm going to hand back now to Elena.
Thanks, Karen. You've done an amazing job bringing all of that together. So thanks to Karen, but for everyone who's participated today. So on behalf of Carers New South Wales and IPPG, the Care Knowledge Exchange team, I'd just like to thank all of our speakers for generating that discussion, because I think empowerment and resilience can really, and I think it's shown today, really mean different things to different people. So I think lots of things, lots of great areas of discussion and lots of things to really think about in terms of our, turning that research into practical outcomes and responses for carers. So as we said earlier, this has been recorded, and we'll make that available to everybody once that's finalised. Yep, again, just a final thank you to everyone, the team, everyone that's helped facilitate, and all of the back end technical stuff. So thank you for that. We're going to finish today's event with a brief guided meditation. I know we were over from just past 12:30, but I think there was important things that needed to be discussed. So I'm going to hand over to Prue, who's probably got about 4 to 5 minutes for a guided meditation to close us out. Thanks so much, everybody.
Thank you, Elena. Aside from being the care in residence for this project, I am also a yoga teacher, and I have found the tools of meditation very supportive in moving through my carer's journey. So this will be a very, very short snippet, which often is all you need. So I might even keep it to just 2 to 3 minutes today. Most of us are seated in a chair. So what I invite you to do is make sure both of your feet are firmly connected to the ground. And then draw your attention to the soles of your feet. Really feel them plugging into the earth beneath you, and to help you arrive in your body. And then place the palms of your hands on your thighs, again, allowing that connection to help you to arrive in your body. And if you need a little more support here, you can give your thighs a little squeeze to let yourself know you are here and you are present. And then from your body, come to notice your breath. Notice the journey it takes through your body. As you inhale, it expands from the belly to the waist to the heart space. As you exhale, it descends from heart to waist to belly. And bring particular attention to your exhalation. And so to exhale is to be in the active practice of letting go. You might like to participate in an open mouth sigh in your next exhalation to relieve yourself of any physical tension. And today, a lot of feelings, emotions may have started to swirl and become overwhelming. And so if you're feeling slightly overwhelmed, overcharged, overstimulated, utilize your next few exhalations to let go. And to let go of just 5% of whatever it is you are gripping or holding onto. And so, for example, in this moment, I am recognizing that my shoulders are creeping up to my ears. I'm holding a bit of tension in that space. And so simply directing the exhalation to my shoulders to offer some release in my body. And generally, a gripping, a tightening, a holding on in the body is a manifestation of the resistance of the mind. So in gently, gently peeling away the stress in the body, you slowly, slowly melt it away in the mind as well. And taking 5 more breaths all together, concentrating on that exhalation, that action of letting go. You can sigh with an open mouth or through your nose, whatever feels more comfortable for you. And bring your hands together. Start to gently rub your palms together to develop a bit of warmth beneath your hand. Maybe there's a little bit of energy, tingling that can be felt. And keep rubbing your palms until the warmth starts to radiate. It's a cold day, so it might take a little bit longer than normal. Cup your hands over your eyes and then feel that warmth radiating towards your face. Once that warmth connects with the skin of your face, start to gently blink your eyes open. First, consuming your hands, noticing the lines, the textures of your own hands. And then when it feels safe to do so, gently peel your hands away to reabsorb the world around you, the computer or device in front of you. Thank you. If you have any questions, please pop it in the chat or reach out to the Care Knowledge Exchange team. Thank you.